Thank you very much. So I'm going to discuss our experience using the 595 nanometer pulse dye laser to treat inflammatory acne in adult females. This was a real-world study, and I'll explain that in a moment. Are the slides?
Oh, here.
Yeah, I'm trying to advance
Oh,
it.
it's not that.
Okay, here we go. So the basis for doing this study was I had a series of patients who came into my practice who had gone on or off various hormonal contraceptive therapies and had an eruption of cystic acne, and they weren't responding to various systemic agents and topical agents, and I treated them very successfully with pulse dye laser therapy. And so we know that this is the most prevalent chronic skin disease in the United States, acne mostly affecting adolescents and young adults, but increasingly there are a greater proportion of adult females who may have lifelong problems. So this was a real-world clinical scenario where adult patients with long-standing acne were maintained on their oral and systemic and topical therapies, and then we added pulse dye laser therapy and looked at the outcomes. This was a prospective IRB-approved clinical trial, healthy adult females with facial inflammatory acne who were already receiving medical treatment for their acne and enrolled in the study. Their medication regimen was initially maintained and then gradually reduced based on tolerance. The subjects received 4 monthly treatments with a 595 nanometer pulse dye laser, and they were followed up at 1 and 3 months after the last treatment. We scored these patients in a variety of ways. We use the Investigator Global Assessment Score to score their acne severity at baseline and follow-up visits from 0 clear skin to 4 very severe. Investigator Overall Assessment of Improvement from -1 worst to 4 complete improvement. Investigator Assessment Improvement in Post-Inflammatory Pigment Change from 0 no change to 4 significant improvement. And then subjects had an overall assessment of their own improvement from no change 0 to 4 significant improvement. And we also performed lesion counts both for inflammatory lesions, papules, pustules, and non-inflammatory lesions, including open and closed comedones. There we go. So in terms of our population, we've enrolled 15 females to date. A mean age was 27. We had phototypes 1 to 4, and 8 out of the 15 individuals had phototype 3 and 4 skin. This is an ongoing study. The mean acne severity score at baseline was 3.55, moderate to severe. At 1 month follow-up, it went down to 1.82, mild or almost clear, and at 3 months, 1.89, which fell in the almost clear to mild region. The mean inflammatory lesion count is shown on the left, statistically significant reduction at 1 and 3 month follow-up. The interesting thing that we found was the mean non-inflammatory lesion count also had a statistically significant reduction at both 1 and 3 months. And what we know about the pathogenesis of acne, I think, may change once we figure out how this is working. I'm sorry, I'm having difficulty advancing. Thank you. So our results, both inflammatory and non-inflammatory lesion counts, were significantly reduced from baseline at 1 month and 3 month follow-up visits. All these test subjects showed improvement in acne severity as evaluated by the investigator at both follow-ups, and all assessed subjects show good to significant improvement with a mean score of 3.3 out of 4 in post-inflammatory pigment alteration at 1 and 3 month follow-ups. And they all reported overall improvement was reported by all at both 1 month and 3 month follow-up. Mild erythema and edema were observed after treatment. There were no adverse events or complications in subjects, including subjects 1 through 4, and everyone was satisfied with the outcome except for 1 who had no opinion, which is unclear. Phototype 4 patient here at 1 month visit, almost clear. phototype 3 patient here, almost clear at 3-month follow-up, almost clear 3-month follow-up, almost clear 3-month follow-up, moderate improvement at 3-month follow-up. Based on the improved outcomes over time with the 720 nanometer patient, we called our patients after treatment, and we had follow-up from 5 patients to see if they had ongoing improvement or just had retained their improvement following treatment. 3 out of 5 subjects reported acne activity continued to improve after the study completion. 1 out of 5 subjects reported acne improvement was maintained since study completion, and 1 out of the 5 subjects said that she still had occasional flares, but now only papules and not cysts. So in conclusion, preliminary results from the study report previous findings that the 595 nanometer pulse dye laser is effective in treating inflammatory acne. Non-inflammatory lesion counts also improved, and we need to figure out why. Treatment was well tolerated, no adverse effects, and this may be an effective and safe way to treat adult female subjects who fail to improve with conventional medical therapy. Thank you very much.